Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about the sweet truth, unpacking the link between sugar and mental health. The mental health burden, a call for new strategies. Mental health disorders are a leading cause of disability worldwide. A comprehensive assessment based on World Health Organization data indicates that over 22% of the global population suffers from a mental health disorder, including depression, anxiety, and PTSD. These conditions carry a substantial social, economic, and health burden. Current pharmacological and psychological therapies, while effective, alleviate less than half of the total disease burden. This highlights an urgent need for additional prevention and treatment strategies, and our dietary choices, particularly our sugar intake, may be a powerful tool in this fight. The study, a large-scale prospective analysis, to provide a robust evidence-based view, this study utilized data from the UK Biobank, a large-scale prospective cohort. The study analyzed data from nearly 170,000 participants aged 37 to 73. Participants were tracked for a median of 10.54 years. The study systematically evaluated associations with three common mental health disorders: depression, anxiety, and self-harm. What makes this study unique is its systematic evaluation of 10 different sugar subtypes, moving beyond a simple total sugar analysis. Key finding one: high sugar intake and increased risk. The study's primary finding was clear. A high intake of several sugar subtypes was associated with a statistically significant increased risk of mental health disorders. Free sugar, non-milk extrinsic sugars, and sucrose all showed similarly high associations with increased risk for depression, anxiety, and self-harm. Importantly, these associations were found to be more pronounced in individuals with obesity, suggesting a potential link between metabolic health and the brain's sensitivity to sugar. Key finding number two: the U-J-shaped relationship. This study's most critical finding was the non-linear U-shaped or J-shaped relationship between sugar intake and mental health risks. U-shaped curve. This pattern indicates that both insufficient and excessive intakes are associated with an increased risk of mental health disorders. The sweet spot is a moderate consumption level that confers a protective effect. J-shaped curve. This suggests that intakes below a certain threshold are protective, but after that threshold, the risk rises significantly. For example, this study found that moderate intake of glucose was associated with a reduced risk of depression and anxiety, while excessive intake was not. Proposed mechanisms: how sugar affects the brain. The relationship between sugar and mental health is rooted in several complex biological mechanisms. Inflammatory responses. Excessive sugar intake is known to promote chronic inflammation, which is a key driver of various psychiatric disorders. Hypothalamic pituitary adrenal axis dysregulation. Moderate sucrose intake may relieve stress by temporarily inhibiting the HPA axis, the stress response system. However, excessive intake can lead to chronic hyperactivation of the HPA axis, triggering sustained stress responses linked to anxiety and depression. Metabolic dysfunction. Impaired glucose metabolism in the brain, often caused by high sugar intake, can disrupt glutamatergic synaptic transmission, which is associated with depression. Neurogenesis. High sugar intake might impair neurogenesis, the creation of new neurons, and reduce levels of brain-derived neurotrophic factor, a protein crucial for brain health and plasticity. The connection extends to the gut and neurotransmitters. Gut microbiota dysbiosis. A high sugar intake can alter the composition of gut bacteria. This disruption of the gut-brain axis can indirectly influence neurotransmitter synthesis and brain function, impacting mood. Neurotransmitter imbalance, fructose in particular, may affect the balance of neurotransmitters by inhibiting an enzyme that regulates glutamate and GABA levels, both of which are strongly linked to mood disorders. The dopamine system. Sugar's impact on dopamine levels, which are involved in the brain's reward system, can also contribute to addiction-like behaviors and mood regulation issues. Clinical relevance, new dietary guidelines. This study's findings have direct clinical relevance. It provides clear evidence-based recommendations for optimal daily intake ranges for various sugar subtypes, not just a generic eat less sugar message. WHO guidelines. The study's findings align with the World Health Organization's recommendation that free sugars should be limited to less than 10% of total daily energy intake. Sugar-specific thresholds. The study offers safe zones and risk thresholds for specific sugars, suggesting that different sugar types, e.g. lactose versus fructose, may impact mental health through distinct metabolic pathways, necessitating sugar-specific restrictions for personalized health guidance. Conclusion, the dose-response dynamic. In conclusion, this large-scale prospective study reveals a critical dose-response dynamic between sugar and mental health. It shows that while excessive sugar consumption elevates the risk for depression, anxiety, and self-harm, the relationship is non-linear, with moderate consumption providing a protective effect. This paradigm-shifting insight calls for more targeted, sugar-specific dietary strategies for mental health disorder prevention and management, with a particular focus on those in obese populations where the effects are more pronounced. While more randomized controlled trials are needed to confirm causality, this research provides a powerful new lens through which to view our dietary choices and their profound impact on our minds. Thank you for listening to this talk. Please consider buying my book, 100 Pathways to Longevity, and subscribing to this channel. Thank you.